you suffering from lymphedema? Take a look at this short instructional video to learn more about your health condition. The lymph system is pretty cool. It collects fluid that gets pushed out of your blood vessels from the naturally high pressure of your cardiovascular system. The lymph vessels filter it, killing off viruses and infections, and then return the fluid back to the cardiovascular system through veins, where it mixes with the deoxygenated blood before getting pumped through the heart again. Most of the time, this is a very efficient system, saving your body about 3 liters of fluid every day. But sometimes lymph vessels can get backed up because of a blockage somewhere. Many times this is idiopathic, meaning we don't know the cause, but a lymph vessel got damaged somewhere and it's causing a buildup of fluid in the surrounding tissue. In this case, it's called primary lymphedema. Secondary lymphedema is when the cause of the blockage is an abnormal growth, surgical lymph node removal, a crush injury, obesity. There's lots of things that could contribute to the onset of lymphedema. So basically, if there's a normal fluid volume going through your lymph system, but transport capacity is impaired, you'll have a buildup of fluid. Also, if the fluid volume increases and transport capacity is impaired, then you'll have an even bigger buildup. This buildup of lymph fluid makes your body swell up. Some early signs and symptoms that you may have lymphedema are skin numbness, burning, aching pain, if your skin feels tight, if a limb feels particularly heavier than normal, difficulty making a fist, and feeling like your range of motion about a joint is less than normal. Later signs and symptoms include increases in limb girth from swelling, changes in your posture, increasing discomfort, skin changes, hair loss, and increased numbness or tingling. There are 3 main stages of lymphedema and a pre-stage called stage 0. Stage 0 is before the onset of lymphedema. Someone in stage 0 is more at risk than others to develop lymphedema because their lymph transport capacity is impaired. This includes people who are obese, someone who just had a surgery that affected a lymph vessel, and people experiencing pain, fatigue, and feeling heavy. Stage 1 is when chronic inflammation begins. And a characteristic sign of stage 1 is pitting edema, where you can press your finger into the swollen area, and when you take your finger away, the skin doesn't bounce right back, so you're left with an indentation. This stage is reversible, though, with the right treatment, so it's important to catch this early. Stage 2 is irreversible. It's characterized by skin fibrosis, scarring, and non-pitting edema because not all the swelling is fluid. Stage 3 is also irreversible and is characterized by increased fibrosis and scarring, non-pitting edema, and changes to the skin like keratosis and blisters. In order to diagnose lymphedema, it's mostly a clinical diagnosis, so your healthcare provider will walk you through some tests. You will most likely have a venous Doppler study to rule out a blood clot, and either a CT or MRI if you've had cancer in the past to make sure that the cancer hasn't come back. In terms of medical management, medications aren't supported a lot by the literature. However, meds that break down proteins to help with reabsorption may show some benefit. Diuretics have shown to have no effect or may even worsen lymphedema, so if you have a comorbidity that requires the use of diuretics, be sure to use them carefully as instructed by your primary care physician. Regular checkups might be necessary as well. Neuropathy medication and NSAIDs may also worsen lymphedema. Surgery may be needed in order to reroute your lymph flow or graft a part of a lymph vessel from another part of your body. In more severe cases, a surgeon may need to go in and remove some of the fibrosis that has formed on the skin. Just like with any surgery, though, there may be complications that arise, so ask your physician if surgery is the right option for you. If you're concerned you may be experiencing signs and symptoms of lymphedema, you should see a physician and a physical therapist immediately. It's very important to catch lymphedema early and begin physical therapy treatment while you can still reverse the condition, rather than progressing through each stage and only be able to manage the symptoms for the rest of your life. I hope this video shed some light on lymphedema for you. Further questions may be directed toward your healthcare provider.